Welcome back to part 2 of your chapter 18 lecture of Pharmacology Clear and Simple for your Allied Health 3 Pharmacology course. We left off here at antihistamines, so that's where we'll start. Antihistamines block signals to the brain's movement center, and they tend to work best on nausea associated with motion sickness. So some over-the-counter medications, Dramamine, Benadryl, and an example of a prescription medication would be the promethazine. And if you look here again, the Dramamine is by mouth, intravenously, or intramuscular. Let's go down and look at the promethazine is by mouth, intravenously, intramuscular, and also per rectum. And again, they're listed next to, so just take note of that as we continue lecturing. Anticholinergic medications, these block the effects of the acetylcholine, which can stimulate vomiting. Prescription medications, examples would be trimethophenamide, scopolamine, both examples, and again, take note of how they are administered here. This also has the transdermal. Cannabinoids, they are a manufactured form of cannabis. An example of this would be the nabinolone, and this is orally before and after chemotherapy. There is a high level of addiction possibility here. Therefore, it is considered a controlled substance. And as we know, marijuana is an herbal form of cannabis, and medical marijuana is legal in many states as well as legal in the state of California. And I guess I'll go back here because this is a debate that I think will continue, again, because it's legal in the states, but it is not legal, or it is not recognized nationally. So it can cause issues crossing state lines, and there are different laws in different states. So it's important to know the state that you are working in and the state that you are an MA in. It's important to know those laws as far as cannabinoids go. Phosphorated carbohydrate solutions like emetrol. These have glucose, fructose, phosphoric acids. It is an over-the-counter antiemetic taken to relieve nausea and vomiting. And this decreases hyperactivity of the gastric mucosa. And it is contraindicated with diabetes, so that's important to note. It is, again, over-the-counter, and it is taken by mouth. Diphenhydramine is an example of this type of antiemetic. If you answered antihistamine, you are correct, and that is Benadryl. Let's look now at medications to treat GERD, or gastroesophageal reflux disease. GERD occurs when the cardiac sphincter is loose, allowing stomach acid to move upward into the esophagus. This causes irritation and damage to the mucosa. Antacids, proton pump inhibitors, and gastric stimulants are used to treat GERD. And antacids create a more alkaline environment, protecting the mucosa. And it's important that the timing of antacid administration is important because it may affect the absorption of other medications. Proton pump inhibitors reduce the acidity of the stomach by binding the stomach enzymes responsible for increasing acidity. And gastric stimulants increase gastric emptying, which improves peristalsis, so fewer stomach contents are present to be refluxed. And here is an example of it backing up there. Again, we talked about what the proton pump inhibitor drugs do. An example would be Nexium or Prevacid. The gastric stimulants, again, they decrease esophageal sphincter pressure and increase gastric emptying. So Reglan would be an example of this. There are side effects, which are drowsiness, restlessness, headache, dry mouth. Medications used to treat peptic ulcers. So an ulcer is a perforation of the mucosa. Peptic ulcers occur when the HCl in the stomach erodes the mucosal layer, and this leads to perforation. Patients at risk for ulcers include those with type O blood, cigarette smokers, those with Helicobacter pylori, and those who do not cope well with stress. Helicobacter pylori is also known as H. pylori here. That's probably more, you've probably heard that more common. Okay, so alcohol, caffeine, and certain drugs can also be risk factors. Medications used to treat peptic ulcers include mucosal protectants, prostaglandins, antispasmodics, H2 receptor antagonists, antibiotics, and proton pump inhibitors. So antibiotics are used to treat and fight the H. pylori bacterium. This is a cause of 75% of gastric ulcers and 90% of duodenal ulcers. And an example would be amoxicillin or clarithromycin. And mucosal protectants cover and protect the ulcer to promote healing, and thus they must be taken on an empty stomach. And an example of this would be the sucralfate. Prostaglandins are hormone-like substances that inhibit gastric acid secretion in the stomach, and they're used to reduce the risk of non-steroidal anti-inflammatory drugs, the NSAIDs, that can induce the ulcers. Example of this would be the Cytotec, and this is taken orally. There is a risk of miscarriage, premature labor, and possible birth defects. So this is not used in pregnancy. Antispasmodics decrease secretion and gastric mobility and reduce gastric spasms. An example of this is dicyclomine, and it is taken by mouth or intramuscularly. H2 receptor antagonists block histamine from binding with the parietal cells and prevent them from secreting HCl. And you're probably familiar with Tagmint, Pepcid, Axid, Zantac. So these are all H2 receptor antagonists, and they're given 30 minutes prior to meals, and they're not given within 1 hour of an antacid. So it's important to remember that because antacids may inhibit absorption of the H2 receptor antagonist. Proton pump inhibitors, they reduce acidity in the stomach, and this was also discussed earlier in regards to GERD. Comprehension checkpoint 4, we're getting close. Okay, here we go. The acid found in the stomach that helps digest food but can damage the stomach and esophagus is the acid found in the stomach that helps digest food but can damage the stomach and the esophagus is, you should have selected B, hydrochloric acid, HCl. Moving on to medications to treat gallstones. Cholelithiasis is the abnormal condition of having calculi formed by cholesterol and calcium in the gallbladder. These calculi are known as the stones, so gallstones. And for patients unable to tolerate surgery, a medication may be used to decrease production of cholesterol and inhibit its absorption by the intestines. Therapy may take up to 2 years, but if no stone dissolution is seen within 12 months, treatment is unlikely to be successful. An example of this is ursodiol, and it is taken by mouth, and again, it can take up to 2 years. Obesity has many causes. So these causes include metabolic abnormalities, overeating, insulin resistance, and sedentary lifestyle. So a morbidly obese person weighs 20% or more than his or her ideal body weight. If lifestyle changes are not effective in causing weight reduction, anorexiants are sometimes prescribed. And anorexiants give a feeling of fullness and sometimes create nausea to decrease food intake. Oh, let me go back here. I wanted to note that the pancreas helps digest carbohydrates and the liver helps digest fats. So just remember, pancreas helps digest carbohydrates, liver helps digest fats. An example of the anorexiant would be the phentermine. Phentermine can be habit forming. It can affect cognitive function, so it's important that the patient knows this and uses caution when taking, as well as if it's taken with other diet medications, it can cause fatal pulmonary hypertension. So you can see here why patient education is so important, as well as looking at all of the medications that the patient is taking and educating them on that. And also important on the pharmacy level when they are picking up medications and keeping a medication list, that we know all of the current meds that the patient is on. Looking now, let's move to lipase inhibitors. And lipase inhibitors, these drugs bind to lipase, so the intestines cannot break down dietary fat, which is eliminated in the feces. These are not used in children or with children or in instances of chronic health problems without close supervision. It's important to note that if these are taken with meals containing high fat, this results in unpleasant GI side effects. Vitamin supplements may also be needed because of that binding and elimination, and orlistat is an example. And this comes in over-the-counter form. Ally is one of the ALLI. You've probably seen the commercials and the colorful bottle. That's always what comes to mind for me when I see that. And Xenical is prescription form. Hemorrhoids are swollen varicose veins. They're usually located in the anus, and fissures are cracks in that same area. For these two conditions, an anorectal preparation is used to decrease swelling and to soothe the cracks. So the anorectal preparations would be the pramoxine or the pramoxine combined with zinc oxide. You're probably most familiar with the over-the-counter preparation H. Flatulence is gas released by the GI tract, and this can be caused by food as well as disease. So dietary changes may reduce flatulence, but if unsuccessful, antiflatulants may be prescribed. So some examples of the dietary changes might be to decrease consumption of cabbage, onions, and beans. And some examples of the antiflatulants we're looking at, like Gas-X or Mylicon. And Mylicon is the over-the-counter product that relieves the discomfort of infant's gas that is frequently caused by swallowing or certain formulas or food. So we see the Mylicon used in infants. Medications to treat fungal infections of the GI tract. So looking here at thrush or oral candidiasis, This is a fungal infection of the mucous membranes of the mouth. You see the white patches, they can extend into the esophagus.